So stomach cancer is a fairly aggressive cancer. It is really the #2 killer cancer that we think of, and it's fairly aggressive, but in spite of that, it shows symptoms sometimes only upon later advanced presentation. And so some of those signs and symptoms that patients might have are weight loss, change in their appetite, feeling full when having a meal sooner than before. Some of those signs are just vague abdominal pain, nausea and vomiting. All of those can be signs related to a stomach cancer. Certainly, we encourage patients to know their family history and having any cancers, but particularly a family history of stomach cancer might prompt them to consider talking with their primary care doctors or specialists at an earlier time. We know when other risk factors for stomach cancers, or any cancer really, precipitate, both stomach and esophageal cancer can have similar risk factors. So obesity, smoking, having a poor diet intake, chronic reflux, all of those can be contributing factors. Excess alcohol use as well can be important to identify early on. And those chronic long-term habits or risk factors can contribute to a risk of cancer. Well, cancer is contributed to by multiple environmental factors and, of course, our genetic makeup. But smoking in and of itself has been found to have so many carcinogens that it relates to all cancers that we know of. From top to toe, we think about smoking as a risk factor for cancer. We know that obesity changes our hormonal makeup. It changes our immune system as well. And so our ability to fight off diseases, infections, but also the cellular changes that cause cancer are more pronounced in obese patients. So we know that we've used Unite in the Fight funds in prior efforts for our breast cancer patients. And so there's a variety of ways I think that it can serve our community and the cancer patients we see every day, including things that are simple like transportation. We have a really broad-based patient population that we see, but many of them are underinsured or poorly insured, and so that creates a difficulty in some of the day-to-day things we might take for granted. Just simple transportation to the clinic to either get seen first as a patient, get their cancer evaluated and diagnosed, to then getting treatment. It's a lot of transportation just to get here. And so we want to be able to assist in some of those other financial burdens that our patients deal with. Certainly, if we can supplement the medications that patients receive, that would be a huge asset to many of our patients who have difficulty affording those. Our cancer care team is heavily invested every day, every moment, inside our inpatient wards and out here at the Outpatient Cancer Center. I think that we do something special in Augusta. We provide the highest level of expertise. We do a multidisciplinary tumor board for multiple cancer areas that provides specialty care that you couldn't find for hundreds of miles. And so I think that is unique to Augusta, unique to our facility in general, but something that we pride ourselves in being able to provide care for our community.